Kia ora, Boyd, and I'll ask Professor Boyd Swinburn to give his sort of take around some of the key messages that he's observed from the sessions this afternoon and today. So Professor Boyd Swinburn is a Professor of Population Nutrition and Global Health at the University of Auckland, and he's worked in academic and research fields for nearly 30 years. He has governance experience as the co-chair of the Lancet Commission on Obesity, co-chair of the Policy and Prevention Group of World Obesity, president of the Australia-New Zealand Obesity Society, and is director of the World Health Organization Collaborating Centre for Obesity at Deakin University. And of course, Boyd is one of my bosses on the board of Te Hiringa Hauora, so know my heart mai, and thank you for agreeing to do this too, Boyd. Kia ora.
Kia ora, thank you, Tane. Can you hear me? Is that all right?
Kapai.
You're coming through? Okay. Right, thanks a lot. Now, I've only been able to duck in and out of the sessions today, but what I heard was fantastic. And then those breakout rooms, I have to admit, some of the gremlins got me and kept on booting me out of the session. So I've only picked up bits and pieces, but what I heard I really liked, and I just want to cover off a few things that I think I kept coming up. I heard coming up. So the first thing is thinking back 5 years ago, would it just be normal kōrero talking about colonisation, neoliberalism, shared governance, poverty, commercial determinants, equity, racism, structural racism, those sorts of things that we are talking about here and dealing with? These are the fundamental issues that we need to grapple with. And I think while they've always been around, they haven't been as mainstream as they have been now. And this just kind of came home to me when I was doing some work just with the university about reaccreditation of the medical school and the medical training and what's happening within public health. What has happened in the last 5 years? Well, actually, one of the big things, I think, is that these concepts are now mainstream discussions, and I think it means we're really getting to the nitty-gritty of what are the determinants of health. So that to me is really a big thing. The second thing, and a few people referred to it, is the issue of timing. You know, the time is right now, I think. We've had a blast with COVID. It's forced us to rethink. There's all the Build Back Better. There's billions of dollars going into various projects, and the government, the previous term of government, had a whole bunch of reviews, especially the health system review, and we have a Labour government that can govern by itself, and a very strong Māori caucus. So there's a whole bunch of stars all lining up, and if we don't grab this next 3 years seriously and try to get progress, then we have missed really a golden opportunity. So I feel a real sense of urgency in getting stuff done, and we heard some of that debate around the Māori Health Authority and what its purpose will be and how much authority it will truly have. So I think now is actually the time. The third thing is that and Phil Schumack said this, people know about what public health is now. Public health is a thing now. People kind of get it, even if it's at least in the space of a virus and how you deal with a pandemic. But the value of the infrastructure, I think, has now landed home on people, that we can't let our public health infrastructure wither away like it has been over the last 10 years and more. So I think now is the time to really use that opportunity to build strong public health infrastructure. And I think part of how we frame this and how we take it forward is what I'm calling the COVID approach. What's the COVID approach to various public health issues? And I think if we can apply the generic COVID approach, then we'll get a lot of distance. So what is a COVID approach? Number one is looking at the evidence, keeping a very close eye on what's happening around the world and in this country, and paying close attention to that and sticking by it. Number two is listening to the experts, because they're embedded deep within it and they know and understand that and are willing to provide advice. Now, what the experts say doesn't always apply in a political decision, but at least there's serious listening to experts. And the third thing is bold action. You know, putting the important things first, putting the population's health first came as the number one priority during COVID. So if we can turn that COVID approach into a broader public health approach for other things that we do, I think it'll be fantastic. The fourth thing is around leadership, and I mentioned the political time that we have now in the political leadership, and we're especially looking towards the Māori caucus to be able to do some Tariana type work in creating strong public health policies. But I think there's also growing leadership within public health that we need to lift up. People mentioned the Health Coalition Aotearoa, which I chair, and I think that's an example of trying to get collective voice. But there's the DHBs have got an advocacy team. The public health units are there. They've got great expertise. If they can find some voice in this, that will add extra strength. I think those leadership voices from those organisations which are highly respected, I think is actually critical. So I think we are seeing the strong emerging public health leadership in this space. And finally is about the people, and there's a lot of discussion about that. I unfortunately got bounced out of the community discussions, community breakout rooms a bit, but there's a lot of talk there about who's doing the mahi, who's on the ground doing it. And there's a lot of people who are working collaboratively. They've got their heads down and doing fantastic things and sort of trying to apply these big principles that we talk about at a global or national level. They're actually applying them at the community level. So there's lots of lessons there about collaborative work. But the problem that we find with all of the community actions is the connection between them, the networking, the sector support, the training, all of those aspects. I think we need to pay serious attention to. Just a day or two ago, ANA said it was closing its doors. Now, ANA has been around for 25 years or so and doing a great job in training and networking in the nutrition and physical activity space. But actually, we're in a bit of a new era now. You know, we're all on Zoom. We're having a Zooey, and you know, I think there are different ways for us to connect and to engage. And so we have to use these new tools that we've got and the new ways of working that we've found with COVID to be able to join up the sector. And I take my hat off to you, Tane, for the great work that you've been doing in sector engagement. I think that's a very strong role for Te Hiringa Hauora. So those were some of the things that I picked up. I'm sure I missed a hell of a lot more than I picked up, but those are my thoughts from today.